there are many healthcare companies in the world and they do useful things in the world. And it's literally that none of them is really about the clinician as the important thing.
Why do you think that independent medical practices are under more pressure today?
So it falls on the shoulders of the clinicians, and that's why they're burning out. And this is the reason.
What would you say your mission is as an entrepreneur?
Yeah, the mission is quite simple, is to be a company that clinicians love.
Why do you think that AI is turning more towards being a lifeline rather than just a productivity boost?
Why it's becoming a lifeline is because that there's something about the administrative work, like charting, it's never ending. It's really like doing this repetitive manual work.
Hello and welcome to Healthcare Journeys. My name is Kevin Rosenquist. I'm your host today. Thanks a lot for being here.
This podcast is brought to you by S2M Health, a trusted partner for U.S. healthcare payers and providers. From accurate risk adjustment coding to full spectrum RCM services, S2M Health combines clinical expertise with precision operations to drive better outcomes across the healthcare ecosystem.
Independent medical practices are quietly disappearing across the country. Doctors are burning out, paperwork is spilling into nights and weekends, and many clinicians are asking a painful question. Is it still possible to practice medicine the way I imagined when I started? My guest today is Erez Druk, co-founder and CEO of Freed, a company using AI to give clinicians something they've been losing for years: time. Freed's AI assistant now supports thousands of clinicians, helping them document patient visits faster and reclaim hours that were once swallowed by charting. Erez, good to see you. Or sorry, Erez, isn't it? It's Erez, isn't it?
Yes. That was, not many can get it right, but yes, good to be here. Thanks for having me.
Yeah, absolutely. Thank you so much for being here. I really appreciate it. I just want to start kind of with talking about just why practices are struggling. Why do you think that independent medical practices are under more pressure today than at any other point in recent history?
Yeah, why? It's a good question. When we started Freed, so Freed hasn't been around for too long. We kind of officially launched 2.5 years ago. And shortly after, so I was living in Santa Rosa, California back at the time. And before the day would get crazy, I'd go on a little walk in the park, which we lived next to back then. And so one morning I'm walking around and, enjoying the morning quiet and sun. There's a little lake there. And I get a phone from an unknown number, a phone call from an unknown number. And typically I don't answer those. For some reason I answered. And I'm like, hello. And there's an anxious voice. Erez, Freed is not working. I'm going to start my clinic in 20 minutes. Like I can't start my day without it. So we didn't have support. We were like 3 people back then. So I'm like, no problem. I'm running home anxious. Get on a call with her and figure it out. She had some 2 accounts, but we fixed it. And she took a breath. This was, of course, a doctor. I believe she was a psychiatrist. And after all of that mess, she kind of told me, we're on a video call, so she's in her private practice. I've been building this private practice for 10 years. It's been horrible. It's so hard. I'm not enjoying it. I'm doing admin work all day long. And I decided to shut the place down and move on. And then I found Freed a few weeks ago, and it really changed everything. I'm enjoying it again. I have time. I can be focused on my patients. I can be with my family. And I'm going to keep practicing the way, keep running my practice.
Yeah. That's a great call to get, huh?
It's amazing, really. I still get those calls, and this is truly why I wake up in the morning and I work fairly hard on Freed. So my point here is not to show off too much, but really to say that this administrative work, that's what she told me. I couldn't do this admin work anymore. It's such a huge burden. I'm sure we'll get to the story of my wife as a doctor. I've known her just before she started the healthcare, the journey to become a doctor. And this work, whether it's documentation or similar stuff, is just like this cloud that is over their heads all the time. You're never done with it. It's always there. You have to do it. It's very important. but it's grueling. It's such manual work.
Yeah, it's total menial tasks and just a time suck.
Yeah. I mean, it's truly never gets off their shoulders. And you asked specifically about small clinics. Big health systems suffer from this too, but they have the means to have 7 administrators for each
Right.
provider, 7.
Yep.
And small clinics not. So it falls on the shoulders of the clinicians, and that's why they're burning out, closing their clinics, and moving on to the big systems. Um, and this is the reason they don't have the armies to really support them to fight against this increasing administrative burden.
Okay. Okay. And what would you say your mission is as an entrepreneur? And what is your mission? What the mission of Freed?
Yeah, the mission is quite simple: is to be a company that clinicians love. And I specifically chose this kind of almost like weird framing because the insight that led to Freed was that there are many healthcare companies in the world and they do useful things in the world. And it's literally that none of them is really about the clinician as the important thing. It's always about the clinician is always a tool in the system to provide care, which is very important. Of course, the goal of healthcare is care, but the heart is the clinician, and really nobody can take care of the heart. So really creating a company that not only creates great products that help clinicians, but also make it as easy and seamless for them to find those products and use them and make them accessible and build a brand that makes them feel good about themselves and make them happy people. And the love again comes from the fact that I truly love every single clinician in the world, starting from my wife, Gabi, who's a family medicine doctor, all our med school friends, all the 26,000 clinicians today that use and pay for Freed. So we really want to give them back so much that the result would be, oh, they love Freed, and Freed is something that makes them just feel good and have a better life overall. So that's the mission, to be a company that clinicians love.
Yeah, I like that. So you mentioned the story you told about the clinician who was considering shutting down their practice entirely. Obviously, the tools of Freed in that scenario help them avoid that. Why do you think that AI is turning more towards being a lifeline rather than just a productivity boost?
Yeah, that's a good question. We have this video. I'll share it with you of this truly. I just love this cliche, like adorable doctor who's been practicing for years and is saying how the interviewer from our team asked him what he would do without Freed, and he said, "I would have retired by now." It's I sent it to you. Maybe you'd love to share it.
That's awesome.
Yes, why it's becoming a lifeline is because that there's something about the administrative work, like charting, that it's never ending. You see 10 to 20 patients a day. You have to do it at night. So you're never done. It's just not fun. It's really like doing this repetitive manual work. But it's so important that you feel, if you're clinicians, you're guilty. Like if you feel guilty, if you submit the note 2 weeks late, it hurts the clinic revenues. It can do something not ideal for patient care. If the next doctor doesn't have the note, they don't know what happened. So you also have this great responsibility to do it. And there are so many things like that it's really just, like what is getting burned out is being a big part of it is the mental load of like, I can't keep up, I can't do all of this, it's too hard, I'm
Sure.
guilty. And I think that's the experience when when my wife was in med school. This was during COVID. I saw all our friends like crack in tears because again, the size of the responsibility was just too great, so they couldn't do everything they need. And I really believe that clinicians are, you see it in the, going off tangents here, but in the white coat ceremony, all these amazing talented people get on stage and literally make an oath to like, I'll dedicate my life to take care of others. And I really believe that this work gets in the way of doing that to the fullest extent. I just think it drives them to the point of to the breaking point.
Yeah, it's a great point too, because I mean, people get into medicine to help people, like you said. I mean, it's a noble thing. It's a lot of work. It's a lot of school. I certainly don't need to tell you that, given the fact that your wife is a doctor.
Yeah,
You know what it takes to get there, and it's a lot. So yeah, taking away admin tasks and all that stuff. Yeah, they don't. That's not doing what they set out to do. Doing
yeah,
admin tasks. Yeah.
exactly. And I forgot the punchline is that AI is really getting so good that it can really take this work and do it in many cases better than the clinician,
Sure.
almost fully autonomously. So it really
Yeah.
takes that huge burden that gets in the way of really fulfilling their life's mission. And I agree with you, these people it's truly their life's mission to go, and they don't do it not for the money, because it's not it's really to take care of others. So it allows them to fulfill their own mission
Yeah.
better and in
Totally.
a happier way.
Yeah, yeah, no, I agree. And one thing about healthcare, it seems, in my experience of talking to people and all that, is a lot of times the industry can be a bit skeptical of new technology, or at least very slow to change and roll out new things. How do you feel that you can earn trust when AI is touching something sensitive like patient records?
Yes. First, I would say what you just said is totally very true, and recently kind of completely changed. So something unique that Fred has done is to go direct to the clinician and allow them to go install the app, pay for it out of pocket, again, all with the compliance needed. And it's one of the very first technologies ever in healthcare that is clinical and grown organically, super fast. So really that adoption curve has changed. The reason for that is that there's suddenly a moment where you can solve a really, really, really big pain point in a very, very easy way, in a way that was completely impossible before. So that's kind of the potential energy of all of that. Yeah, I think in terms of earning trust, I see it in two dimensions. One is the kind of the what would be the word? The very kind of the let's call it the baseline of you have to meet certain requirements. You can't listen to patient conversations without really ensuring patient HIPAA compliance,
Right.
the right level of security. So there's kind of the baseline you have to clear, which is actually not too hard, but you need to be very diligent and you need to prove it to the market. It's on us. So that's number one. And number two, you need to build something that is so good that you convince the clinicians trying it. Maybe I'll tell you a little story. Our very first doctor who used Freed, we took a patient 4 weeks, and the product wasn't great yet. 4 weeks, she was telling us, "Oh, it's so helpful, but I'm still typing my notes during the visit. It's so helpful, I'm still typing my notes during the visit." And after a few weeks, I remember she messaged me and said, "I'm not typing my notes during the visit anymore because I know that Freed will do a great job, and that I don't need to do it." So the way to earn the trust is, what is trust? It's consistently delivering what you promise over and over again until someone knows you'll do that.
Yeah.
So that's the way to get this trust, and we take the trust very seriously, and we have investing heavily in the quality of the product, the reliability. We do have issues when we do. We take full responsibility and do our best to make good with our customers. But yeah, that's where the trust comes from.
Do you feel like people are more open to something like Freed now because AI has been around a little bit and people are starting to at least maybe kind of understand it?
Yeah, I do think that we're getting to, not just in healthcare, to kind of reach mass adoption where AI is something that everybody talks about.
Sure.
Like billions of people use that ChatGPT and the like. So I definitely think that wave is a part of what we're riding here. If you zoom out into healthcare, that's also something. There's a clear realization that AI is helpful in healthcare. It's very much needed, and in the right use cases from the right providers, it's very helpful, and the adoption is very fast. So, I think we kind of reached this, this adoption curve with new technologies of like innovators, early adopters, late adopters. We're definitely crossing the chasm to mass adoption and awareness, and everybody, AI becomes a part of everybody's lives very quickly. So we're taking a small and hopefully meaningful part in that.
So instead of replacing electronic health records, Freed works around them. Why is that philosophy important?
And the philosophy, more precisely, is, how do we reduce, how do we reduce how do we make things very seamless for the clinician? EHRs are great technologies that made healthcare better overall, but they are also not great in the sense that they create a terrible experience for the clinician. Clinicians spend more than 50% of their day, 50% of their day, their eyes are in the EHR doing things. And these are not friendly systems that you want to spend anytime.
Yeah, a lot of them are like really old, right?
Some of them, I mean, it's really crazy. It's funny. This is related to the main point, but we have a small team that's working on how do we interface with EHRs. And every time we put a new person on that team, they come back after a few weeks and with epiphany. Okay, now I understand why the need for AI, why we're so valuable, because they see they can't believe what they're seeing.
They can't believe what people are actually using.
Yeah, and again, people are using these for years, 50% of every single day.
Yeah,
and they are at work. So our approach is not necessarily yes to replace, not to replace, but it is to make things seamless. So EHR integration. So our customer base uses 200 different EHRs. Integrating with them is somewhat of a lie in healthcare. There's no good way to integrate with the vast majority of EHRs. And even if there is, it's not great. So we took a new approach that we developed with using AI. So we built an agent that a clinician can go into the EHR, open the agent, and then we call it EHR push. This thing operates the EHR like a human. You can see Freed. It literally tells you, I'm navigating to the patient chart. I'm reading what happened before. I'm putting in the information, and it literally clicks and does the work for the clinician. It's really like magic. And again, I think it's both the magic of AI and our team that built this amazing thing. The point is this allows us to have a more seamless way to operate the EHR on behalf of clinicians without the cumbersome work of implementing integration. It's very costly on the clinician side if we did. So it's a new way to get around the EHRs and make them almost like build an intelligence layer on top of them. I should have started by saying the reason we decided to build this in the first place is that until recently we had 3 million times a month a clinician would come into Freed, open a note that we generated, and start copy pasting it, bit by bit, go from this step to this step, and it's like the most painful thing to watch. And we're still saving them time, but it's just it's like still there's so much cumbersome work. So this is why we built this solution. I think over time, if we're talking big picture, EHRs can't stay the way they are with the technology, with what's possible today. So they would either reinvent themselves to be much more agentic, autonomous, like assistant type systems, or they would be replaced by companies who would build things like that. As Freed builds more and more capabilities, we will get into the realm of replacing EHRs as well. I'm sure of that. It's not like the main goal, but this is the inevitable future. But one thing for sure, EHRs the way they are today, it's with what's possible, they are really slowing down healthcare and make a lot of people unhappy, to say the least.
Yeah, I'd agree with that. So when you have a client who, gets Freed going and they get some of their time freed and all that, you're working to do for them, what do you see, in them, in their practice that changes? How does how do their lives change once they get this implemented and they can stop doing all that busy work that you were talking about earlier?
Yeah, there's pretty early on we run ads to advertise Freed. First, because we want more clinicians to be aware of it, and two,
Sure.
it's making sense. We want to build a big business so we can build more and more for clinicians. So we run some Facebook ads, and this one guy commented on our advertisement, and the comment was a selfie of him in his hot tub, saying, thank you, Freed. I bought this hot tub 2 years ago, and I used it 0 times because I never had the time to go into the hot tub, and now I finally can go home early and enjoy myself. And then he says, "Do yourself a favor, pay the $99 a month. This is like what freedom feels like." So the answer there is first is that it really gives them the freedom back in terms of time. You said it beautifully at the beginning. Time is the one thing that clinicians absolutely don't have enough of.
Yep.
So that's number one. And then a lot of second order effects happen as a result from that. First, clinicians are happier and more present in their visits. So the clinicians tell us that their patients kind of feel the difference because, again, in terms of 50% of the time in the EHR, now they look at the patient and spend more quality time with them. The back office is happy because the documentation is ready on time. It's good documentation. It's not, I didn't have time, so I just wrote one sentence. And even the clinic is happier because good documentation, healthcare is a business, sometimes more than it even should be, but it helps streamline the revenue process and, get denied less times by insurance, which happens way too much, especially with small clinics.
Absolutely.
Really the ripple effect of just saving clinicians time, taking some admin work off of them is really making all the constituents of healthcare happier. So that's what happens. For me, the number one thing is the happiness of the clinicians. This is also always for me the thing that, again, kind of is the core purpose and what makes me, as I said, wake up in the morning and feel proud of the work we're doing.
Yeah, absolutely. I mean, there's no it's no secret that there's a lot of bottlenecks in the healthcare system. You can talk about insurance, you can talk about the platforms, you can talk about all sorts of stuff, but it all adds up to the care could be better. And this kind of stuff, like freeing up doctors to actually be doctors seems like a pretty good thing for all of us.
Yeah, and the way we think about it, we're freeing them up to be good doctors, I don't want to say good or better, but be more parents because they have more time, take care of themselves. Like all of these stuff are important, and really, without time, none of these can thrive. So, yeah.
I feel like you mentioned that obviously any size clinic can benefit from a new an upgraded system, one that uses AI like Freed. It seems very very like a great use case is the smaller practices though, because of the fact that because they're so 1, 2, 3 person shows a lot of times. Do you think that this could help the small clinics sort of survive for longer because of the fact that they can now be free to do what it is that they spent years of their lives training to do?
Yeah, so in the past 15 to 16 years, the portion of healthcare that is small kind of private clinics went down from 60% to 42%, I believe. That is slowing down, fortunately, but still not. I want to see this trend go in the other direction. I think that's very sad. I was just reflecting recently on, when I was a small kid. I know my name is weird because I'm from Israel. So I grew up in Israel in a small town, and my sister, my brother, and myself would go to the same doctor. His name was Dr. Rosen. I remember him very clearly. My parents would go to him as well. His office was a room in his house, and in the reception, you would see your friends and people from your street because it was very kind of local, almost like community care.
Yeah.
I think that's very special, and I think that's very important. I think that going away from the world is bad. Moreover than that, this is something that my wife Gabi helped me understand, is that it's actually way more important in the US because US has much more of these rural communities that this type of local care is the only access they have to care. So when that goes away, nobody's going to drive 100 kilometers to the nearest hospital. So this is literally healthcare access.
Yeah, it's a big problem. Access is a big problem. Yeah.
Yeah, and small clinics are a big part of the solution.
Yeah.
So as I mentioned earlier, back to the question, does it help small clinics? Yes. Taking this load off of them first allow clinicians to just keep at it for longer, as I mentioned in some of the stories that I shared. those are all private practices that are still open because the burden is taken away. And it also allows them to thrive more. So not only the clinicians, but the clinic itself. So for example, we're now working on an AI receptionist. So the idea is you don't have to have someone, I don't know if you've seen some of the new technologies of voice AI. You probably have.
Yeah.
It's better than a human. It's always patient. It just understands what you says. It's always empathetic. It would answer anytime, even if there's 100 calls at the same time. So it's like it's amazing. And you still need a receptionist, but you don't need a receptionist to be next to the phone and answering everything. You know, like you can really organize the work for them and make everybody happier.
Yeah, for sure.
So as we take more and more of these chunks of administrative work that is expensive, makes the clinic less efficient, we allow them to be just better businesses, stay afloat, while the people inside are happier. So 100%, this is helping, and would only increase in helping small clinics thrive more by having less admin burden. I also really like what people say around AI right now is as bad as it would ever be, right? It's only getting better from here. So all of these things that are now, like this receptionist, a year from now, it will be much faster and smarter and would know how to do a lot more things. Our documentation would only get better.
Yeah, it's going fast. It's not.
Oh my God,
it's not a hot take there. Everyone knows it. It's going fast.
Man, the world is moving so fast that even our market of scribes, we are not a unique snowflake, but one of few when we started at the right timing. And now there's like so many. The world is just accelerating, which is fun and scary at the same time.
Yeah, it is. And you know, do you find, as far as the fear goes, do you find that you have a harder time convincing older people who've been in the business for a really long time, that something like AI can help them? Because I feel like a lot of people, you know, and I'm not picking on older people. I mean, you know, just anybody over a certain age seems to be really, I don't know about this kind of an approach to AI. Do you feel that in the medical world too, in the healthcare world?
So that really depends. I would say overall, so it depends on the category. I think there are different types of tasks. I would crudely separate them to clinical and non-clinical. Overall, if we think about documentation, again, it is clinical, but the documentation is not like when you make decision making or decide what kind of thing to prescribe. That's still decided, of course, by the clinician. So creating the note is a cumbersome task that very few clinicians feel like pride of that. So that's an area where, and the pain is so big that my expectation early on was that the friction would be much higher than it is, but the adoption is very high and people love that, even on the older side. Of course, you have the late adopters and people that I would never ever.
Oh yeah,
AI.
Those are the same people who believe Terminator will happen, right?
Right. Yeah, in some cases for sure. I think when you get more nuanced, so we are now rolling out clinical decision support. So we'll actually we're still not ever making any clinical decisions, but we give clinical answers to clinical questions like, hey, what's the recommended dose of X? And this is where, when you get closer to these areas, people get more protective for good reasons. Like, hey, can I trust this information? Because now this can influence what I'm doing in the visit, and we're making sure and doing everything needed in order to make sure that the full control and the decisions are still in the clinicians. But as you get closer and closer to the clinical, that's where people are rightfully becoming more risk averse and protective of the patients, because that's their job. So I think it's totally fair. I would say in general, like, doctors and clinicians are, again, definitely you have the old folk, and people are not old folks in general, but like you have all kinds of people, but overall they are extremely rational and pragmatic people that want to learn and are open to learning and understand that technology is important. So
yeah, that's a good point.
Yeah. So overall, it's been a much more of a pleasure to see the reception versus like people fighting the change.
Yeah.
But yeah, change is hard.
Change is hard, especially when you're talking about something that people don't feel like they have time to implement, right?
Right. This is a key point. If it takes time to learn or implement or configure, a ton there's a lot of friction because, again, they don't have time and they don't want to do that.
Yeah.
And the magic of Freed and other companies is who do similar work is that we really created a magical experience where you start using it, it's creating value right away. It learns your style over time, so it's very seamless. So the seamlessness is very important. If it's hard, then they just don't have time and they shouldn't spend time learning the next cool tool they need to do the real jobs.
Well, I think we're conditioned too, right? To think anytime a new system comes in, whatever company you're working at or wherever you are, anytime you get a new system, there's a learning curve. It's a pain in the butt. Think about like how there was a time when you got a new phone. It was really complicated. You spent hours and hours and hours getting it set up, learning it, figuring it out. Same with a new operating system, a new Windows. But now it's not really that way anymore, especially with these AI tools. They're maybe not plug and play, but they're getting pretty damn close.
Yeah, I mean, how hard is it to use ChatGPT? You go in there, you type things. Actually, someone said something funny. If you really don't know how to use ChatGPT, you go to ChatGPT and ask, how do I use
ChatGPT?
Right? But literally, it's so powerful.
That's true, though. Yeah.
We're now shifting the experience in Freed to be more AI native, we call it. But really, you can talk to Freed. It has personality. You can ask it any questions. So, and again, this is all for the sake of making it both powerful but so seamless to adopt. And again, I think this is one of the things that AI is getting really, really, really good at.
Yeah. Yeah, it's improved quite a bit in just a short amount of time, for sure.
Right.
All right, Erez, well, it's been great chatting with you. Thanks so much for being here. The company is Freed. Where can people find you?
So search Freed. I believe the first result that comes up in Google or in ChatGPT, it's get Freed or just freed.ai. My email is on the website. If you have any issues or if we can improve, please let me know. And try the product or recommend it to a clinician friend. I really think this is I have confidence in one thing, which is it makes their lives better. And these people are important, and all we are here for is to help them. So, free.ai.
Awesome. Well, thanks again, Erez. Really appreciate you being here.
Thank you. Thank you so much for the time and giving me an opportunity to share some of the story.